Accidental poisoning of hand sanitizer. People around are looking for a convenient way to kill bacteria and germs when soap and water is not available, or even when it is available. But are hand sanitizers as helpful as hand washing? And is there a harm? Let's take a look. Alcohol based liquid hand sanitizers have become ubiquitous as a protective measure from infections. The downside to the widespread availability of hand sanitizers is that they offer easy access. What is our concern? Hand sanitizers seem to be everywhere right now as families try to prevent the spread of coronavirus disease 2019 COVID-19. However, this has led to a rise in accidental ingestion by children who have ingested the germ killing liquid, which can be lethal. Many hand sanitizers contain up to 60 to 95% ethanol or isopropyl alcohol by volume and are often packaged in brightly colored bottles with scents that are appealing for young children. Unfortunately, this can lead to both accidental and intentional ingestion among children. Children and confused elderly patients and your pets are at risk of unintentional ingestion. Kids will in fact put just about anything into their mouths. Your body can handle small amounts of isopropyl alcohol. In fact, your kidneys remove approximately 20 to 50% of isopropyl alcohol from your body. The rest is broken down into acetone by enzymes known as alcohol dehydrogenases. This acetone is filtered out of your body through your lungs or kidneys. Preventing hand sanitizer poisoning. Keep these items out of reach of children. Store your hand sanitizer with medicines and household products which should be away and out of the sight in a cabinet where a child cannot reach them. Monitor any hand sanitizer use. Make sure your child only uses hand sanitizer under adult supervision. Tell children to keep hands away from their faces, especially their mouths. Get into the habit of hand washing instead. The best way to clean hands is hand washing with soap and water. Hand sanitizers should only be used when hand washing is not an option. Be prepared for an accidental poisoning. If your child has ingested a poisonous substance, remain calm and call for help. Ingestion of alcohol based hand sanitizer can cause serious adverse effects in children. Symptoms may appear immediately or may take a few hours to become noticeable. Stomach pain, confusion, dizziness, slow breathing, low blood pressure, rapid heart rate or tachycardia, low body temperature, nausea, vomiting, throat pain or burning sensation, slurred speech, unresponsive reflexes, and in severe cases, it can lead to coma. A lick of hand sanitizer won't hurt a child or anyone else. Drinking it in large amounts can cause alcohol poisoning. What to do if there is hand sanitizer poisoning? In case of accident or if you feel unwell, seek medical advice immediately and consult a physician. Show the safety data sheet to the doctor in attendance that comes with the sanitizer if available. If swallowed, call a poison center or doctor if you feel unwell. Drink plenty of water to help your body flush out the toxin. However, don't do this if you have symptoms that make it difficult to swallow, such as throat pain or decreased alertness. If vomiting occurs naturally, have the victim lean forward to reduce the risk of aspiration. Do not induce vomiting unless directed to do so by a medical personnel. Never give anything by mouth to an unconscious person. The signs and symptoms include abdominal pain, stomach upset, nausea, vomiting, and diarrhea. Your doctor will ask for blood tests to help make a diagnosis. Complete blood count to look for signs of infection or damage to your blood cells. Serum electrolyte level to see if you're dehydrated. And the toxicity panel to determine the concentration of isopropyl alcohol in your blood. What will your doctor do after investigating? The unabsorbed ethanol may be removed by gastric lavage. Adequate ventilation with maintenance of airway is important in a comatose patient. Sodium bicarbonate may be administered to alkalinize the urine. Hypoglycemia is common and should be corrected with dextrose infusion along with simultaneous administration of 100 milligrams of thiamine parenterally. In life-threatening emergency, hemodialysis may be done to lower the ethanol levels rapidly. Presented to you by the Youth Red Cross Unit. Youth on the move. Stay safe.